What if your body started producing milk when you weren't pregnant? Or even if you were a man? What if your period stopped, your sex drive vanished, and you felt exhausted without knowing why? These unusual symptoms can all be caused by one common hormonal disorder, hyperprolactinemia, a condition where the body produces too much of a hormone called prolactin. Prolactin is best known for its role in helping women produce breast milk after childbirth. But when its levels rise abnormally, it can throw the entire hormonal system off balance. Often caused by a small benign tumor in the brain's pituitary gland, hyperprolactinemia can lead to infertility, vision changes, and serious health complications if left untreated. In this video, we'll explore what hyperprolactinemia is, why it happens, how it affects both women and men, and what can be done to diagnose it and treat it. Hyperprolactinemia, characterized by excessive production of prolactin, is one of the most common hormonal disorders linked to the pituitary gland. This small gland, located at the base of the brain, plays a central role in the endocrine system. Elevated levels of prolactin lead to decreased levels of sex hormones, primarily estrogen and testosterone, resulting in various associated symptoms. One of the primary causes of hyperprolactinemia is a benign pituitary tumor known as prolactinoma. These tumors can be classified as microadenomas if they are smaller than 10 millimeters, or macroadenomas if they are larger. Microadenomas occur 20 times more frequently in women, while macroadenomas are equally common in both sexes. Microadenomas do not invade surrounding structures, whereas macroadenomas can. In some cases, pituitary tumors that produce prolactin may also secrete other hormones, most commonly growth hormone. Other significant causes of hyperprolactinemia include masses pressing on the pituitary stalk, various medications, decreased thyroid function, and kidney failure. Medications such as antipsychotics, antidepressants, and some treatments for high blood pressure can raise prolactin levels. In kidney failure, the elevated prolactin level results from the reduced clearance of the hormone, and some viral infections affecting the chest can lead to transient increase in prolactin levels. In women, hyperprolactinemia often causes menstrual disruptions, infertility, and sometimes weight gain or changes in the skin. Inappropriate milk secretion, known as galactorrhea, is common. Galactorrhea is defined as any milk secretion occurring 6 months after stopping breastfeeding. Persistent hyperprolactinemia can also lead to decreased bone density called osteoporosis, particularly in the vertebrae. Premenopausal women tend to notice signs and symptoms early, when tumors are smaller in size. This is probably because of missed or irregular menstrual cycles. In contrast, postmenopausal women tend to recognize signs and symptoms later, when tumors are larger and more likely to cause headaches or vision problems. During a typical pregnancy, estrogen production increases, which can promote the growth of tumors. This may result in symptoms such as headaches and changes in vision, especially in pregnant women with large prolactinomas. Larger prolactinomas can exert pressure on the healthy part of the pituitary gland, leading to lower levels of hormones controlled by this gland, including thyroid hormones and cortisol, the stress response hormone. If left untreated, a prolactinoma may grow large enough to compress the optic nerve, which is located near the pituitary gland. The optic nerve transmits visual information from the eye to the brain, and the first sign of pressure on this nerve is often a loss of peripheral vision. Men tend to notice signs and symptoms later than women. For men, symptoms can be subtle and may include impotence, reduced erectile function, loss of muscle mass, decreased libido, and infertility. Although less common, men can also experience galactorrhea. Both men and women may suffer from headaches and vision problems due to the pressure exerted by the tumor on surrounding structures in the head. Diagnosis of hyperprolactinemia typically involves consultation with an endocrinologist. The doctor will first gather medical history, perform a physical examination, and request basic laboratory tests. It is important for patients to provide the names and dosages of any medications they are taking, ideally by bringing a list or the medication containers. If hyperprolactinemia is suspected, a fasting prolactin level is measured. This involves taking a blood sample in the morning after fasting for at least 8 hours, allowing only water. The next step often involves imaging of the head using magnetic resonance imaging, MRI, to identify any pituitary tumors. Notably, small tumors may not always be visible. Treatment for hyperprolactinemia depends on the underlying cause. Regardless of the cause, certain medications can help manage prolactin levels. If medications are suspected to be the cause, efforts should be made to reduce or discontinue them. For cases related to kidney failure, a kidney transplant may be necessary. If masses are compressing the pituitary stalk, treatment options may include surgery, radiation, or medications. Hormone replacement therapy can address issues related to decreased thyroid function. In cases involving pituitary adenomas, treatment varies based on whether the adenoma is a microadenoma or macroadenoma. For microadenomas, medications that decrease prolactin production are usually the first line of treatment. These medications often alleviate symptoms, restore normal menstrual cycles, and improve fertility. In some instances, microadenomas may resolve spontaneously, and after 2 years of treatment, there may be an opportunity to stop therapy. For macroadenomas, the primary treatment goal is surgical tumor removal, which may not always be feasible. However, medications that inhibit prolactin production can also alleviate symptoms and, in some cases, reduce tumor size. The treatment outcome largely depends on the underlying cause of hyperprolactinemia. In many cases, the cause can be effectively addressed, or satisfactory symptom control can be achieved. For microadenomas, the prognosis is generally positive with consistent therapy. In macroadenoma cases, the prognosis is influenced by tumor size and any invasion into neighboring structures. Hyperprolactinemia may sound complex, but with the right diagnosis and treatment, it is a highly manageable condition. Whether caused by a benign tumor, medications, or another underlying issue, the key to effective treatment lies in recognizing the symptoms early and working closely with your physician. For many people, simple blood tests and imaging can reveal the cause, and medications alone are enough to restore hormonal balance, improve fertility, and relieve troubling symptoms. In more complex cases, surgery or hormone replacement may be needed, but the outlook is often positive, especially with timely care. If you or someone you know is experiencing unexplained symptoms like irregular periods, infertility, reduced libido, or even unexpected breast discharge, don't ignore them. Understanding your hormones is the first step toward taking back control of your health. Thanks for watching. If you found this video helpful, consider subscribing for more educational content. Have a great day.